Hi, this is Dr. Manjunath, fertility expert and laparoscopic surgeon. Welcome to my fertility talk. In this video, I am going to tell you about ovulation tracking. Ovulation tracking is when exactly the ovulation will happen. So, when you have sexual activity during those days, you will have maximum chance of conceiving. So, ovulation tracking is basically to find out the approximate time of ovulation. So you know that ovulation is nothing but the release of mature egg. Usually this happens in the mid-cycle. Suppose if the cycle is around 30 days cycle, usually it happens either 14th, 15th or 16th. So usually in the mid-cycle, 2 or 3 days the time, that's the peak of mid-cycle. The ovulation happens under the influence of hormones. These hormones, like usually the FSH and LH hormones, will stimulate the ovaries. So once the immature egg will start becoming mature, the follicle will increase in the size and the follicle will release the eggs during 13th, 14th or 15th. So these hormones has to act in a proper way so that the ovulation can happen in the mid-cycle. Many a times these hormones will not act in a proper way and the ovulation won't happen. So usually generally we take it if the cycles are regular, say around 28 to 30 days, the ovulations will happen. So what are the methods of ovulation? It's an ovulation tracking. Before the methods of ovulation tracking, you need to know that during those days, that 3 to 4 days of mid-cycle, if you have sexual activity, the chances of conceiving will be maximum. So the whole idea of tracking the ovulation is to have sexual activity during those days so that you will have a maximum chance of conceiving. So what are the methods of tracking this ovulation? Basically there are so many methods, but usually the 3 most effective methods are calendar method, basal body temperature, that is called as BPT. The third one is ovulation kit, urine kit, ovulation kit. So these are the 3 most effective method of ovulation tracking. So in calendar method, you need to mark your first day of the cycle, and this calendar method is basically followed if you have a regular cycle of 28 to 30 days. If you have irregular cycle, you cannot follow this calendar method. So when you mark the first day on the calendar, usually the ovulation will happen somewhere between 13th, 14th, 15th. So 13th, 14th, 15th day on the calendar you need to mark. Not the date of 13th, 14th, 15th date. It's a day of your cycle. So during those 3 or 1 or 2 days before those expected peak, you need to have sexual activity either daily or alternate days. Alternate days of sexual activity is preferred because the sperms are going to stay for 3 to 4 days in the vagina or in the cervix. So if you have sexual activity in alternate days during those middle peak, the chances of conceiving is more. This is known as calendar method. The second method is BPT, which usually many times it's difficult to follow. Many people will not follow this. So they need to measure the temperature using the thermometer. You should measure the temperature by keeping the thermometer under your tongue in the early morning before you get up, or just as soon as you get up. So you need to track that, and whenever there is consistently the temperature is rising by ½ degree to 1 degree, or a half or 1 or 2 to 3 Fahrenheit, 1 to 2 Fahrenheit, consistently for 2 to 3 days, then the most likely the ovulation is going to happen. So during those days, if you have again sexual activities, the chances of conceiving will be more. The most effective method is the ovulation kit. The commercially available ovulation kit you can buy it from the medical shop, and you start measuring the LH surge in the urine. Just like how you do a urine pregnancy test, you need to measure those LH surge by putting 2-3 drops of early morning urine, and that monitor should begin as early as day 9th or day 8th of your period and start measuring that LH surge. Whenever there is an LH surge, usually 12 to 36 hours later, this ovulation will happen. So during those days, again, if you have sexual activity, there is more chance of conceiving. So I would say that ovulation kit is sensitivity is around 40 to 50%, maximum 60% sensitivity. So this is known as LH kit, urine kit for measuring the ovulation. To monitor the ovulation. So apart from these are all the things which you can do at home. But when these are all not so effective, the most effective is follicular scan, that is ultrasound monitoring of the follicles, which is again the best method of ovulation to say when exactly the ovulation is happening, which is again done in the hospital by a fertility expert.